Mauro Berruto from Italy, Torino. How are you doing?
Moment. Well, it's really difficult moment, tragic moment. I'm a sportman. I'm quite used to face challenges. It's not a new situation, but this challenge is really something that I never saw in my life. It's really something that happens once in a life. I hope at least once in a life. And it's difficult to describe, and I want to try because the most important thing in this moment is that we feel all together that this is not an Italian problem. It's a pandemic, so it's literally a world problem. And I'm trying to spread messages through my friends in Europe. And of course, I have a lot of friends, and I love Finland. And I just want to give you some messages from the center of the problem here in northern Italy. I'm living in Torino, that is really one of the cities, Milano, Bergamo, Brescia, Torino, Piacenza. We are all in 150 kilometers, and here the situation is really, really, really bad.
How would you describe the situation right now to your fellow Finns? You're living really close to the most terrible area at the moment. What is the situation there? Because we saw numbers coming from Italy. They went rapidly up, but for the last three days, there was a small...
Not yesterday.
Not yesterday anymore.
Not yesterday. No, yesterday, especially in Milano, there was again a rising of the number of persons having the virus. It's really, Alexei, trust me, it's really difficult to realize, because normally anything is okay. Most of the people is feeling okay. I want to start from a point that you were talking about numbers. Well, it's quite crystal clear at the moment that the real number of people having the virus is 10 times bigger than what is written on data.
At least, I mean, yes, at least.
We have 60,000, around 65,000 people having the virus. The true number, the real number, is probably 600,000 or even more. And where is the real problem is that most of them, they have no symptoms. They feel normally, they feel well, no fever, no cough, nothing. But they are spreading the virus, and so increasing the number of people having the virus. And I think that 10%, well, let's say a big part need to go to the hospital. About 40 or something like that, people that are tested positive. And 10% of those needs intensive care. So that means, sorry if I'm a bit hard, that they put a pipe in your throat and you can breathe only because of a machine. But the numbers, well, for sure in Italy, but I think all over, the true drama is that the number of beds in intensive care and number of machines that are helping people to breathe is a limited number. And now people is dying like flies because there is no spaces in our hospitals. And we are talking, about north of Italy that has a high level of quality in their hospitals. So the only tool that we have in this moment that, of course, is not a therapy, it's not a drug, it's not a pill, and it's not a vaccination, is to avoid to spread the problem. Because if the big number of people positive to the test is decreasing this 10% of people that needs intensive care, and so hospital can take care of medium level cases. The virus is walking on people's legs.
Yeah, like it is, like we've been saying in Finland, that the virus itself doesn't spread itself. We spread it, and we should act, every one of us should act like we already had it.
Yes.
But the thing has been in Finland that,
exactly.
that most of Finns, they realize the situation. They realize how bad the situation can be. We've seen videos, we've seen everything from Italy, but not still all realizes, because it really hasn't hit that hard in Finland yet. We have like 5 people died at the moment as we're speaking. I don't know, probably those numbers will be a lot higher later this week. Was it the same kind of situation in Italy that people didn't realize before they actually started seeing people dying?
Alexi, I can understand totally you and Finns. 3 of March, 2nd of March, we had 3 cases. 3 of March. Now is 27th of March. We have tested 65,000 cases. And huge number of, because, you know, when it starts with this mathematical proportion and the peak that we are hoping to see. But even the peak is a fake problem, because it's impossible to have a peak for the whole Italy. I mean, if Milano will reach the peak, it doesn't mean that in Napoli they are reaching, or in Bari, or in Torino, or in Venice, they are reaching the peak in the same time. So, you know, you have to handle situation where in some part of the country, in very few time, you need to react to an explosion of numbers. And trust me, it's like I'm talking to my past. I don't know if I explain. 3 of March, we were exactly like you are saying.
Yeah.
Okay, this is a problem. We have to pay attention to do something. Well, anyway, it's a sort of bad flu, and we have just few cases. It's not a flu. It's not a flu. And there is one even more dramatic thing I want to tell you, that literally, trust me, young people is killing their parents or their grandparents. Grandsons are killing their grandmothers and grandfathers. That is against the human nature. I mean, it's horrible even to think, but if you realize it's true that the biggest health problem is for over 70 or 75 with, you know, other pathologies like heart or diabetes or you know, but healthy people that maybe has the virus and they don't even know it, and they do it without knowing it, with an hug, they are killing their parents and their grandparents. That is, you know, any night, any single evening, we watch our television showing, you know, reportage that are, because if they bring one of you, of your member of your family or your parents or your relatives, and they are bringing him or her to the hospital, the whole family have to go to quarantine. You can't have any contact anymore with the person that is going to the hospital. And it's an horror movie, Alexi. Any single evening, these stories of nurse or doctors that are the last thing that these people that is dying can see, and, you know, passing the phone to say the last goodbye, or because after that, you know, it's forbidden to go to the funeral. It's forbidden.
I see. We haven't. It's
really mentally devastating.
We haven't seen that stage yet in Finland. Though when we're looking at the numbers, and I've been looking only at the numbers for the last 4 weeks, and Finland has been reacting, but we have been reacting slowly. But we've been reacting. I think we still have the advantage. We're living up north. We have only 5.5 million population. We are really spread out for the whole country. And as we're speaking, yesterday Helsinki was locked down, and Uusimaa, so the area, as you know, with Espoo, Vantaa, it's totally locked down. You can't go outside of Helsinki, and you cannot come in because the virus is mainly right now in Helsinki. But the question is, we made a huge error letting Finns who've been living abroad, flying back to Finland, and there's been calculation estimations. Some saying it's been 50,000 people coming to Finland. Some say it's 200,000, and there was no official guarantee for those people. Okay. They were let for their own, just to take care of, just advice, and that's a dangerous thing to think at the moment. That through our Helsinki-Vantaa airport, they've been just advised. There's been no laws that you gotta stay at home or otherwise you'll be punished. It's for as we speak, and it's been only free of choice.
You are a sportman.
Yes.
You know that there are moments when it's useless to try to find out who is guilty.
Exactly.
Or the mistakes that you did. The most important thing is to react. Making mistakes. We made a lot of mistakes. I told you.
A lot.
But in this moment, from any side, political or medical or economic, because you can imagine Italy is literally on his knee.
Mm-hmm.
From an economical point of view. But in this moment, until the tsunami is done, it's not useful to define which kind of mistakes you or we did. The most important thing is to realize as soon as possible the true situation and to make the right things so far. You have, let me say, you have, I can imagine, a couple of weeks of advantage.
Yes.
I mean,
and that's,
this other situation.
And that's been, and that's been the message in every single video I made, that, you are exactly right, that it's, at this point, it really doesn't help us,
No.
thinking of, you made this decision wrong. It's already made. The ball is already played. You got to think for the next ball, and we have to think what we can do right now and what we can do tomorrow. Yeah.
Spain, other example. Spain had this smaller advantage, let's say 1 week, 7-8 days, but they react late, and you can see now they are having the big problem inside.
Is there any, Mauro? Is there any estimation at the moment? Because we've been having, like I said, we've been having estimations in January, and they've been turned upside down, and there's no point to find a guilty people for that, because nobody could estimate, nobody could see this happening. Is there any estimation in Italy right now when this could be over, when this could be at least somehow in control?
Well, I don't want to be catastrophic, of course, but the first thing is that we have to realize that it won't be over until somebody somewhere in the world will find a vaccination. It won't be over because it's a global problem. So even if you solve it in your country, the virus doesn't know borders, and so anytime it's possible to have it back. So probably in any case, what we called normal until 1 month ago won't be normal for months and months and months until we will find or the vaccination or a very effective therapy, something that, some drugs that are saving your life. So of course, we will start thinking that is a risk, but there is a risk that you can run because there is a therapy. At the moment, we are just driving in the dark, in the night. There is no real therapy being efficient. There is no vaccination, and so. So I'm telling you exactly what I know in this moment in Italy. For sure, for example, is really, 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 almost sure that school will not open again until the end of the school season. So
it's the same in Finland already. Everybody knows that, and if we're talking about like sports, which is secondary or at the moment, sports will not be running I don't see them running, not even during the summertime.
No, probably not. The topic, the issue is the economical side. So, companies, because at the moment in Italy, they are working only those that are giving essential stuff. So food or medicines or something like that. And what they are trying to understand, if to have some different level of return to a sort of form of normality. So probably people under 55 will be able to return to work probably after Easter. Easter, it's half of April. In different levels, but they are thinking to save this lockdown for people over 60 or 65.
Okay.
In order to divide this two categories. This is also terrible. We are both country where democracy and where the idea that all the people are the same, it's quite. But you can imagine we have to think to take care of people over 65, asking them to keep the lockdown, and people that is active working slowly return to work.
But already you're saying already on Easter you're thinking of that in Italy.
Sorry?
That you're thinking of that it might happen already on Easter, that people would under 55.
This situation could happen in May, second half of April or May, if we will reach this stable decreasing of the numbers.
Okay.
That it was a very small good signals in the last 2 days, but then, as I told you yesterday, again there was a peak. So it's not arrived that moment yet.
What would be, Mauro? What would be your message to Finns at this stage? Like we've seen that we have the advantage at this point. What would be your message to close this?
I have 3 messages.
Yes.
Stay home, stay home, stay home. This is the only thing that is avoiding the virus to spread. This is the only thing. Then, of course, washing hands for long times, any time is possible, taking care even of these packages, boxes of when you have food, they have to be cleaned because the virus can survive for hours, or some hours, on plastics or on papers. Then, of course, some normal hygienic stuff. But the very thing making the difference is to stay home. I have been locked down here in my apartment from 8th of March. I went out two times to get food for me and for my parents. Yeah. 2 times in the last, I'm a person that was quite active, moving, traveling, taking trains, flights. And when I have my mother and my father, they are both 85. And when I go to them to bring food, I leave the bag in front of the door. We stay 3 meters or 4 meters. We say hi with the hand. We can even shake our hands. No. And that is my life in the last 20 days. Yeah. From 8th of March.
But with Finns, as you know, you've been here a lot. You know that we're not that physical with each other. So I think
true.
we have
We hug and kiss a lot more.
We're not.
It's true. But
we don't do that. Hey, Mauro, thank you for this message. I really appreciate it. I hope Italy will survive really soon, and we will get everything back to normal.
I told also in another interview that you were so important to teach me this philosophy of Sisu.
Sisu, yeah.
That now is really important. I want to say something more.
Yeah, please.
This challenge is not. We don't need to be resilient, because being resilient, it means that when all this will be over, we will be the same like before. I do hope that this stuff will change us. will change us in a positive way, of course. We have to think a lot in this. We have a lot of time to think in this moment, locked in our houses, and the real tragedy is if after that we will be the same like before.
That's well said.
This is a great. It's really, trust me, it's really difficult to say. This is an opportunity because the last thing that I have in my mind.
I know exactly what you mean. The world won't be. The world won't be the same after this.
Yes.
We're getting back to normal, but we're not getting back to the same that when we were before. Yeah. No way.
And this have to be the good news. I mean,
yes.
Being back in a different way, and this is what we can take like positive side of this situation. Now, in this moment, of course, we have to resist and we have to take care of our health, of the health of our, family, neighbors, and people around us. But then I hope in Italy, I'm almost sure that it will be impossible to forget. It's impossible to forget some videos that we are watching any night that
yes.
coffins are forced to be bring by army and moving to different cities because you can't have enough places to make a funeral in your hometown. Can you imagine? And we don't have to forget. So you know me a bit. I like reading and I like writing.
Yes.
I'm writing a lot because what we are living will be useful in the future. We have to remember. We have to make this exercise, and then I hope, of course, soon we will be back to a better world.
I hope so too, and thanks for this message to Finns, Mauro. I really appreciate it, everybody. Really appreciate this from Finland. And
Finland gave me so much that if I can give something back with a message that is, I'm not saying I'm doing this, but any one of you and anybody will listen this story, trust me, can be a hero because can save lives.
Exactly.
And save lives. And you told a very, very interesting thing. We have to act like we have the virus. That's true. If we move like that, we save lives. That is quite big stuff to do.
Thank you, Mauro. And we'll stay in touch. Take care in Italy.
Yeah, thank you. Bye.
Thank you. Bye.
Bye-bye.